disorder. An early diagnosis of these individuals can definitely lead to better outcomes. And I'm just going to read something from the Public Health Agency of Canada. If FASD is diagnosed early, interventions may be able to lessen its impact. For example, an effective management plan for ongoing supports can help prevent people with FASD from developing secondary disabilities and can help them lead more productive lives. Research shows that individuals exposed to alcohol before birth who began participating in developmental programs between birth and age 5 have experienced positive results. Employment coaching and supported living can also help the person with FASD to find and keep a job and become independent with ongoing supports. Despite their disabilities, people with FASD have many positive qualities and can enjoy very successful lives. So the cost of FASD is quite high. Families struggle to come to terms with this disability. Children with FASD can present a constant challenge. The cost of treatments, of programs, special education, and psychotherapy can be financially crippling for families. It's estimated that these programs can cost $24,000 a year. Perhaps the highest price, though, is the loss of potential for the individual, for families, for communities, and for society as a whole. More than half of these people will not complete their education, and because of that, have an inability to earn a living due to mental illness and behavioral deficiencies. The homeless count among their numbers people with FASD. They also are incarcerated, and the cost of jailing young offenders and adults is estimated to be anywhere from $80,000 to $125,000 Canadian dollars a year. Prevention is obviously key here. As I said earlier, it is the single greatest preventable cause of mental and learning disabilities. Why do we need to still get the message out there in 2010? Physicians have known that alcohol has a negative effect on individuals since the 1970s. Still, those, and including healthcare professionals, seem to perpetuate some of the myths out there, such as it's okay to have the occasional drink. It's not unusual to have a couple in prenatal classes say that they've heard that it's okay to drink maybe once a day or have the occasional drink. The healthcare professionals do not condone binge drinking. That's large amounts of alcohol that are consumed frequently or even just once. But there seems to be some misconception out there among the general population that alcohol during pregnancy may still be okay. However, current research still shows that there is no lowest dose known or lowest amount of alcohol known that won't have any negative effect on the unborn baby during pregnancy. So the bottom line here is that if you're pregnant, don't drink alcohol. Taken further, if you're considering having a baby, don't drink alcohol. This also extends to reading labels. We often counsel pregnant women to read the labels on over-the-counter medication before they take it to see if it's recommended or not recommended during pregnancy. Alcohol is contained in some medications and should be contained on the label. You can always ask the pharmacist. You can always call Mother Risk and ask for advice. Also, non-alcoholic beer still has some alcohol in it. So reading labels is very important. What about the mom that says, do you know what, I was drunk when I got pregnant, or I was drinking? Well, there is no way of telling if that amount of alcohol had any negative effect, but these women should talk to their healthcare provider and again can contact Mother Risk. Mother Risk has a dedicated drug and alcohol line and information section. This seems to be the sole responsibility of women. Well, in part that is true because it is women who get pregnant and carry the baby to term. However, support is vital. Partner and family support and community support. Partners and families can help a woman not drink during pregnancy. And if there is a problem, if the family is more at risk for drinking during pregnancy, there are community supports and community programs that can offer their support. Pregnancy can be a window of opportunity for women to improve their health by changing lifestyles for the health of their unborn baby and for themselves. So the positive steps that can be taken towards reducing the numbers of individuals living with FASD is to continue to raise awareness, to prevent FASD through preconceptional counseling, and through identification and counseling of women and families at risk. The resources used for this podcast will appear in the Resource Exchange section of the professional web community. Included is a free online accredited course on FAS for physicians and allied health personnel who work with pregnant women. Thank you.